We'd like to start with a thank you for considering donating your blood stem cells or bone marrow to a patient in need. These donations are an amazing act of generosity and hope. On behalf of all patients, their families, and of course the Stem Cell Donors Australia team, thanks for taking the time to learn about what donation will mean for you. If you've been asked to watch this video, it's because you've been selected as the best match for a patient either in Australia or overseas. This means that it is very likely that you'll be asked to donate, so we want to make sure you understand what comes next in the process. First, you will have been asked to attend a workup appointment, where a haematologist will conduct a physical examination and information session with you. This appointment is scheduled within 30 days of when the donation is needed and takes 2 to 4 hours. It's a good idea to bring a friend or family member to the appointment as a support person. Just keep in mind that this person will be present when discussing your intimate health details, so it helps to choose someone that you feel comfortable with. We always try to arrange these appointments at the same hospital where you'll make your donation if you proceed, and that this is the most convenient location for you. However, you may be required to travel. Your donor support coordinator will discuss with you how we'll cover all your travel costs and incidentals. So, let's break this appointment down in more detail. The physical examination is your haematologist checking that you're all good to go, so there's nothing to be nervous about. You'll be asked to complete another health questionnaire. You will have answered some of these questions before, but your haematologist needs to double check and discuss your answers with you. Then you'll be asked to have a chest X-ray, an ECG, and some blood samples taken. Your haematologist will also assess the veins in both of your arms and how you are likely to react to general anaesthetic should you undergo a bone marrow collection. Because you can't donate if you're pregnant, you'll also be asked to take a pregnancy test if appropriate. Just as important as the physical checkup is the information session. At the end of this appointment, you'll be asked to formally consent to the donation if all goes well. So it's important that you have a really good understanding of what's involved if you decide to proceed. Your haematologist will talk to you about the donation and transplant in some detail, explaining what will be done and if there are any risks involved. Depending on the patient's clinical needs, you will either be asked to provide a peripheral blood stem cell donation, known as a PBSC, or a bone marrow donation. Your care team will review each donation method with you and explain when and why you might use a particular donation method. For PBSC donation, your haematologist will discuss the possibility of a backup bone marrow donation if not enough cells are collected during the PBSC procedure. You and your support person will have the opportunity to ask lots of questions. Everything from understanding how your cells will work their way into a patient's bones and start making blood, to how long will the donation process take, or can I eat or go to the toilet while hooked up to the machines? You can even ask if it's okay to work on your laptop or watch a movie. Your donor support coordinator has offered you the chance to talk to a past donor if you wish. We encourage you do this before your appointment, as this will give you an idea of what questions to ask and how things will go. If you're interested, just let your donor support coordinator know. At the end of this appointment, you'll be asked to sign consent forms declaring that you agree to donate. It's critical that you feel absolutely committed to donating before you sign. Although you can change your mind later, doing so could have fatal consequences for the patient. Once you have made this commitment, we'll let the patient's care team know so they can start making their preparations for the transplant. Your donor support coordinator will stay in touch, especially about any delays as you start to prepare for your donation. If you become unwell at any time before your donation, it's important that you let your donor support coordinator know straight away, as this could affect the patient. Around 1 week before the transplant, the patient will undergo pre-transplant conditioning, where they will receive chemotherapy and/or radiotherapy to remove their existing bone marrow in time for the transplant. This treatment can cause death if donor cells are not available in time. If you're providing a PBSC donation, you'll need to boost your blood stem cells with injections known as GCSF. GCSF encourages your blood stem cells to multiply and enter your bloodstream. The injection is administered daily over 4 days. You'll be shown how to give yourself these injections during your workup appointments. If you feel uncomfortable self-injecting, a support person or medical professional can assist you. You'll need to avoid any strenuous activity while on GCSF, so here's the perfect excuse not to go to the gym. If you're providing a bone marrow donation, then you won't need GCSF. However, you may be required to fast before your general anaesthetic. However you are donating, remember to pack a bag to take with you. PBSC donation takes between 4 to 6 hours, and a bone marrow donation is typically a day procedure, but you may need to stay overnight. So your bag should include your entertainment, reading materials, a phone, or anything else to help you pass the time during or after your procedure. And it's always a good idea to bring some paracetamol with you, just in case you feel any discomfort. If you need to travel to your donation, your donor support coordinator will provide you with all your travel and accommodation details. They'll also help to provide any documentation you need to get leave from work. You may want to share your experience through social media, letting others know that you're donating and how it feels. Please remember that the lead up to your donation can be the most challenging time for a patient, and it is crucial that we protect their anonymity as well as yours. So don't share online the date of your donation or any details that you may have been told about your recipient. You will be well supported at every step of the donation journey, and your donor support coordinator is on hand to help you with everything from your travel and expenses, your appointments and your health, to your social media posts. Now you're ready for your donation. We'll provide more information separately about the day of donation and what to expect. If you have any questions, please refer to your donor guide or contact your donor support coordinator. Lastly, all of us in the Stem Cell Donors Australia team want to thank you for bringing the patients and their families hope.